everyone. I'm pleased to be here today in the virtual company of my colleague, Minister Philomena Tassi, to provide an update on the latest developments in our fight against COVID-19. On Friday, Dr. Tam and Dr. New presented the latest COVID-19 modeling data. The trend is clear. We can expect Omicron cases to continue to surge at very high levels while monitoring for a potential peak in the coming weeks. Though the individual risk of hospitalization is lower for Omicron, the sheer volume of cases will likely see further increases in hospital admissions. These forecasts underscore that we must continue to exercise prudence in order to limit the coming surge. We all know what to do. A, keep physical distanciation. B, wear a mask. C, stay prudent and limit in-person contact. And most importantly, D, continue to speed up our vaccination campaign. This is the best way to support our frontline workers, our healthcare system, and help maintain the critical functions of our society during this time. Vendredi, les docteurs Tam et New ont présenté leurs dernières données de modélisation de la COVID-19. La tendance est malheureusement claire. Nous pouvons nous attendre à ce que les cas Omicron continuent d'augmenter à un niveau élevé pour atteindre un pic potentiel au cours des prochaines semaines. Bien que les risques individuels d'hospitalisation soient plus faibles pour Omicron, le volume élevé de cas augmentera nécessairement les admissions à l'hôpital. Ces prévisions indiquent ainsi que nous devons continuer à faire preuve de prudence pour limiter les impacts de la vague actuelle. Nous savons toutefois ce qu'il faut faire. 1. Maintenir une saine distanciation physique. 2. Porter un masque. 3. Rester prudent et limiter les contacts en personne. Et 4. Continuer à accélérer notre campagne de vaccination. C'est la meilleure façon de soutenir nos travailleurs de première ligne, protéger notre système de soins de santé et aider à maintenir les opérations essentielles de notre société pendant cette période. As mentioned in the past, although we are going through the worst phase of this pandemic in terms of cases and hospitalizations, January 2022 is not March 2020. We have plenty of tools and knowledge that we didn't possess back in March 2020. Public health measures, personal protective equipment, tests, and most importantly, vaccines are all essential tools in our toolbox in our fight against COVID-19. As of today, we are adding a new tool in our pandemic toolkit. As you know, this morning, Health Canada authorized Pfizer's antiviral treatment, Paxlovid. This prescription drug, which can be taken at home, will be used to treat adults with mild to moderate symptoms who are at high risk of progressing to serious illness. This is welcome news that we hope will help save lives, reduce illness, and lessen the burden on our healthcare systems and healthcare workers. En plus des outils que nous avons déjà, tels que les mesures de santé publique, le port du masque, les tests rapides et les vaccins, aujourd'hui, nous ajoutons un nouvel outil dans notre arsenal visant à lutter contre la COVID-19. En effet, ce matin, Santé Canada a autorisé le traitement antiviral Paxlovid de Pfizer. Ce médicament sur ordonnance qui peut être pris à la maison sera utilisé pour traiter les adultes atteints de symptômes légers à modérés qui présentent un risque élevé d'évolution vers une maladie grave. Il s'agit d'une bonne nouvelle qui, nous l'espérons, contribuera à sauver des vies, à réduire la maladie et à alléger le fardeau porté par les travailleurs de la santé. I want to take a moment to thank, on behalf of all Canadians, all healthcare workers who continue to work tirelessly during this extraordinary time. You are Canada's heroes. And to all Canadians, I encourage you to express your gratitude to healthcare workers by following public health advice and getting vaccinated whether it be your first, your second, or your booster dose. Let's be clear, no drug, including Paxlovid, is a substitute for vaccination and public health measures. Je veux profiter de ce moment au nom de tous les Canadiens pour remercier tous les travailleurs et toutes les travailleuses de la santé qui continuent de travailler sans relâche pendant cette période extraordinaire. Vous êtes nos héros. Et j'encourage toutes et tous à exprimer notre gratitude envers les travailleurs de la santé en respectant les consignes de la santé publique et en nous faisant vacciner, que ce soit pour notre première, notre seconde dose ou notre dose de rappel. Soyons clairs. Aucun médicament, y compris Paxlovid, ne peut remplacer la vaccination et les mesures de santé publique. Thanks to our strategic pre-procurement approach, Canada has already received the first shipment of more than 30,000 treatment courses of Paxlovid, with another 120,000 on the way in February and March. To help inform with their planning, the Public Health Agency of Canada and its officials have provided provinces and territories with preliminary interim considerations on deliveries. They have also discussed deployment based on a per capita basis. With Paxlovid being authorized, distribution to provinces and territories will begin immediately. We are also working with Pfizer to firm up a longer-term delivery schedule with the intent of bringing additional treatment courses to Canada as quickly as possible. Grâce à notre approche stratégique en matière d'approvisionnement, le Canada a déjà reçu 30 000 traitements de Paxlovid, en plus de 120 000 traitements dont la livraison est prévue en février et en mars. Paxlovid ayant maintenant été autorisé, la distribution aux provinces et aux territoires commence immédiatement. Pour les aider dans leur planification, les représentants de l'Agence de la santé publique du Canada ont fourni aux provinces et aux territoires des indications au sujet des livraisons à venir dans le court terme. Ils ont également discuté du déploiement qui se fera sur une base per capita. Nous travaillons avec Pfizer pour établir un calendrier de livraison de plus long terme dans le but d'offrir des traitements supplémentaires au Canada le plus rapidement possible. My dear colleague, the Minister of Public Services and Procurement, is here to tell us more. Over to you, Minister Tassi.
Thank you, Jean-Yves, and good afternoon, everyone. I acknowledge that I am participating on the land which is situated on the traditional territory of the Haudenosaunee and Anishinaabe peoples, my hometown of Hamilton. Our government continues to take action to protect the health and safety of everyone in Canada, as we have been doing since the beginning of the pandemic. My department, Public Services and Procurement Canada, is working tirelessly with the Public Health Agency of Canada to procure the supplies needed to keep us safe. The best thing all of us can do to protect ourselves and our loved ones is to keep up the vaccination effort and follow public health guidance. We have enough vaccine doses in Canada right now for all eligible Canadians. But we also know that effective, easy-to-use treatments are critical to reducing the severity of COVID-19 illness for those in high-risk groups. In addition to vaccines, these treatments can save lives. This morning's announcement that Health Canada has authorized the use of Pfizer's COVID-19 antiviral treatment, Paxlovid, is welcome news. And it marks another important milestone in Canada's fight against COVID-19. In December, I announced that Canada had secured 1 million courses of the treatment. And today, I am pleased to announce that we have already received our first shipment of more than 30,000 treatment courses of Paxlovid, with at least another 120,000 on their way between now and the end of March. Aujourd'hui, j'ai le plaisir d'annoncer que nous avons déjà reçu notre première livraison de plus de 30 000 traitements de Paxlovid. Et qu'au moins
There
120
is at
000
least
autres
another
traitements seront
120,000 treatment
expédiés
courses on the
d'ici la
way
fin
between now
du
and the end
mois
of March.
de mars. My officials and I continue to work with Pfizer in order to finalize the delivery schedule for the remaining treatment courses and to accelerate deliveries of this highly sought after medication wherever possible. We will always do what is necessary to protect the health and safety of everyone in Canada, and that includes ensuring access to safe and effective treatments. After living with this pandemic for nearly 2 years, the latest wave has been particularly hard. But Canadians are doing all the right things to get through to the other side, and they continue to make sacrifices every day to protect themselves, their family, and their fellow citizens. We're going to get through this together, and I want you to know that your government has your back and is going to be with you every step of the way. We're going to continue to procure the supplies needed to get us safely through this pandemic. From securing safe and effective treatments to ensuring steady deliveries of vaccine doses and rapid tests, our government will not stop until we finish the fight against COVID-19. Thank you. Merci.
Okay, thank you so much, ministers. We have 45 minutes for questions. We will split the time evenly between the room and the questions on the telephone, and we'll start in the room with Abigail Beeman from Global News.
Hi, good afternoon. Given the limited number of this treatment on its way, 1 million courses, and given the backlog in PCR testing, the difficulty to get that test, and given that this drug needs to be given very early on in the course of the illness, how effective do you see this being both in the short and long terms?
Thank you. Well, the good news is obviously that we have one more tool in our toolbox. This is a relatively recent tool for which we were working very hard. Obviously the stock being now in Canada is significant, 30,000 treatments. They are being sent immediately to provinces and territories, so they'll be available for clinical use very quickly. So that's the good news. The work obviously involves for clinicians, doctors and others to prioritize as Pfizer also says they ought to do, to prioritize the use of those drugs for the people that are most susceptible to benefiting from them. So there is clinical guidance which doctors shared this morning that clinicians will want to follow in order that this is used not only in the proper manner, but also for the most important people to be looked after.
And a question for Minister Tassi. Minister, we hear that this drug is quite expensive. I'm wondering if there's anything you can share about the cost and whether the cost has an influence on the 1 million number, and whether you hope to buy more after that 1 million course. Any light you can shed on how much you hope to procure in future?
So we have procured 1 million, that's secured, and we have an option to procure another 500,000. From the beginning of this pandemic, we've been committed to Canadians. The health and safety of Canadians has been our top priority. From a procurement perspective, whether it's vaccines, PPE, medical supplies, we've done everything that we can possibly do with the priority of keeping Canadians safe, and we're going to continue on that same track.
Canadian Press.
For Minister Duclos. What do we know about how many courses of antiviral like Paxlovid would be needed to treat high-risk patients?
Thank you for the question. 30,000 treatments have already arrived. 120,000 will arrive between now and the end of March. Each treatment comes with 10 actual pills, 5 days, 2 pills every day. And we expect those treatments to be, as I said earlier, quickly used by clinicians across Canada, not for all purposes. Obviously, the directives, the guidelines provided by experts in collaboration with provinces and territories, these guidelines are very important, and they've been not only prepared, but shared with experts and provincial and territorial leaders over the last few weeks, so we expect that to come quickly and to not only to save lives, but also to protect the health of Canadians who would otherwise be susceptible of ending up with a very severe case of COVID-19.
Also for Minister Duclos, what do you say to the statement from Chinese authorities that Omicron arrived in their country via a piece of Canadian postal mail?
Well, this is a conversation to be had with experts and scientists. As we know, and as the WHO has wanted to seek for quite some time, is more data and more transparent evidence from China on where and how the COVID-19 originated about 2 years ago now. So we expect that China to follow the guidance and respond to the requests of organizations like the WHO to provide, as I said, more transparency on not only what arrived, but also how we can work better together internationally with the WHO to make sure that whatever risk or outcomes arise in the future, we can better manage them at the global level.
Tom Perry with CBC.
Hi, Minister Duclos. It's actually a follow-up on that. What China is alleging is that an outbreak of Omicron in Beijing originated from a parcel or a letter that was sent from Canada. So given what we know about the virus, how likely do you think that is, that's the case? And if it's not the case, what do you think China is doing here?
Well, to be very honest with you, I don't know where that is coming from, and we'll check with officials and our partners around the world. I think this is something, but not only new, but intriguing, and certainly not in accordance with what we have done both internationally and domestically.
Given what we know about the transmissibility of Omicron, do you think there's any chance that a letter sent from Canada to China could have transmitted the disease?
Well, as I said, I'm no expert and would need to ask both for more information and more expertise on what is being claimed. Ben, je dirais que, écoutez, ce sont les experts qui peuvent trancher sur ce genre de questions. J'ai évidemment ma propre opinion, mais pour qu'une opinion soit à la fois crédible et utile, il faut avoir plus d'informations et le point de vue d'experts sur la question.
Louis Gouin, Radio-Canada. Est-ce que vous espérez, avec cette pilule antivirale, d'en arriver à une utilisation élargie pour possiblement plus largement que ce que l'on prévoit actuellement, que c'est vraiment pour les personnes qui sont plus vulnérables aux maladies graves? Est-ce qu'avec les défis d'approvisionnement qu'on connaît, on sera même capable un jour d'élargir l'utilisation de cette pilule?
Les experts répondraient probablement que oui, parce que la science progresse quand même assez rapidement. Nous avons la chance aujourd'hui d'avoir un médicament qui fonctionne pour les populations les plus à risque. Et ce sont ces populations qu'il faut évidemment traiter à court terme et à long terme aussi, évidemment. Mais il y aura probablement, de ce que j'entends, des améliorations de ce genre de traitement ou d'autres formes de traitement qui vont émerger au cours des prochaines semaines, des prochains mois pour traiter ou bien différentes populations ou traiter différemment les mêmes populations plus vulnérables.
Quand espérez-vous voir peut-être un effet concret, notable et significatif sur la courbe des hospitalisations, par exemple, au pays? Et d'autre part, parlez-moi de la difficulté, parce qu'on est en compétition avec tous les pays pour obtenir cette pilule-là actuellement. Est-ce que ça joue du coude en ce moment pour avoir cette pilule-là? Expliquez-moi la difficulté peut-être au niveau de l'approvisionnement.
Je vous dirais que en matière d'approvisionnement, la ministre Tassi et son équipe et tout le gouvernement ont travaillé quand même très bien au cours des derniers mois. Nous sommes, si on regarde à l'échelle internationale, un des premiers pays à la fois à approuver le médicament, mais aussi à avoir des doses sur place. Certains pays qui ont peut-être, qui sont très rares, là, ont peut-être cheminé différemment au cours des dernières semaines, mais être capable aujourd'hui même d'avoir des traitements au Canada et de pouvoir les distribuer rapidement aux provinces et aux territoires et d'avoir avisé les cliniciens à l'échelle du pays de comment ces traitements peuvent être utilisés. C'est une fierté, je pense qu'on peut avoir comme Canadiens, de pouvoir observer tout ça. Oui, on commence
Inaudible
avec 30
question.
000 immédiatement. Il y en
We have
aura 120 000
30,000
dans les
doses
prochaines
for now.
semaines.
We're expecting
Et comme vous l'avez
120,000 in the
suggéré,
next few weeks.
comme
But
d'autres
as
choses,
you've
y compris
suggested,
les tests rapides, y
like with
compris les
anything else,
vaccins,
like
il y a
rapid
un peu
tests and vaccines,
un an maintenant. La concurrence est très forte, mais le Canada s'en
competition
sort
is
très bien.
high, but Canada's
Et
doing a
une des
good
raisons
job.
pour laquelle on s'en sort très bien,
One reason for
lorsque vient le
this
moment de combiner
is
les
that
approbations
when
de
we
Santé Canada et
have
les processus
to
d'approvisionnement, c'est que
get
les compagnies
combined
pharmaceutiques
supply
ont
and
beaucoup confiance dans le
approval
processus d'approbation de
processes,
Santé Canada.
we
Et
have to say
avoir
that there is a
l'approbation
lot
de
of
Santé
faith
Canada, ça
in
les
Health
aide
Canada's
à obtenir
approvals.
la confiance et
And so
l'approbation
when we
d'autres
get
pays.
that approval,
Alors,
it
ils
makes
voient
it
souvent le
easier to
Canada
get
comme
approval
étant
in
en
other
tête de ligue
countries.
des
So
pays avec
Canada
lesquels
is a
ils veulent
leader among other
traiter des
countries.
approbations nécessaires, mais aussi avec lesquels ils veulent ensuite rapidement ajouter l'approvisionnement et
So when
l'utilisation
we're seeking approval,
de
we
ces
need to
vaccins,
follow up with
de ces
supply
tests et de
and
ces traitements
procurement.
ici, comme l'annonce
And that's what we're
le fait
doing here
aujourd'hui.
with today's announcement.
Okay, we will now go to the phone lines as there are no more questions in the room, and we will come back to the room if there is time. Over to you, operator.
Thank you. Merci. For questions on the telephone, please press star 1 on the device's keypad. Pour toute question, au téléphone, faites étoile 1 sur votre appareil. The first question, première question, est de Raphaël Pirot, agence QMI.
Raphaël
À vous la parole.
Pirot from
Please go
QMI
ahead.
Agency. You have the floor.
Oui, bonjour, Monsieur
Question.
Duclos.
Hello,
Je
Mr.
voulais
Duclos.
savoir le traitement en ce moment qui vient d'être approuvé. Jusqu'à quel point est-ce qu'on peut parler
With regards to the treatment that
d'un
has
point
just been
tournant
approved,
dans la pandémie?
can we say
Est-ce
that
que
this
vous
is a
pensez
turning
que,
point in the
justement,
pandemic?
ça va nous aider à baisser les
Will it
hospitalisations
help us
vraiment à long
reduce
terme, peut-être pas pour la vague
hospitalization
Omicron,
rates?
mais pour
Maybe not
les
for the
prochaines
Omicron
vagues qui,
wave,
il y
but
en a.
maybe for future waves?
Merci beaucoup pour la question.
Answer. Thank you
La
for the
première chose que
question.
je dirais, c'est
The
que
first thing I
mieux
would
vaut
tell you
prévenir que
is
guérir.
that
Donc, il est toujours préférable de
it's
ne
better
pas être
to
infecté par la COVID-19
prevent
ou
than
d'avoir
to
un
treat.
risque
So it's better not to get
d'hospitalisation et de
infected,
maladies
to
sévères
reduce
plus faible. Et ça se
hospitalization,
fait
but
par
failing
la
that,
vaccination.
we
Donc, la
can,
vaccination reste l'outil le
and that's
plus
the only way
important, non
to
seulement
do
à court
that is
terme, mais
through
aussi à long terme,
vaccination. So this is
pour
the
se
best
protéger collectivement de la
tool we
COVID-19,
can
mais
use
aussi pour
both
se
in the short
protéger
term and the long
individuellement.
term to protect us
La deuxième
collectively and
chose, c'est qu'il
individually.
y a
The
des
second
gens,
thing we can,
en
the
raison de
second
leur
thing is that
âge,
there are some people
de leur
who, because
capacité
of
de
their
s'immuniser
age
par
or
le
their
vaccin
immune
contre la COVID-19,
system or their
en raison du
access
fait qu'ils
to
peuvent être
vaccines,
immunosupprimés,
perhaps they
des gens
are
plus vulnérables. Il y a des gens
immunocompromised or more
pour qui même la
vulnerable.
vaccination a
For these
malheureusement
people,
un effet
vaccination
faible sur leur immunité
protects
contre la
them
COVID-19. Et c'est pour
less.
ces gens-là
And
que
so for
le
these
Paxlovid
people,
dont on parle aujourd'hui est
Paxlovid
le plus utile.
is
Donc c'est un
the
outil de
most
plus,
useful
mais ce n'est pas un outil
extra
qui est
layer.
nécessairement meilleur que la
It's an
vaccination.
extra
Au
tool,
contraire,
but it's
pour
not
la
better
très
than
grande majorité des
vaccination.
gens qui nous écoutent,
Much
la
to the
vaccination,
contrary,
c'est
for
ce qu'il
most
faut
people who
continuer
are
à faire
listening,
pour
vaccination is really
prévenir
the
et
way
se
to
protéger,
go
plutôt que
to
d'avoir à
avoid
être
infection
traité et
rather than
éventuellement
have
à
to
être
be
guéri.
treated
Donc, je
and
dirais que
cured or
malgré
healed.
la bonne nouvelle d'aujourd'hui, il faut continuer
So,
à insister
despite
sur l'outil
today's news
principal
being
qui est la
positive,
vaccination,
we have
tout en
to
célébrant le
continue
fait
to
qu'on a
focus
un outil
on
additionnel, mais surtout pour
vaccination,
des
which is the
populations
key
plus
tool.
vulnérables.
And now we have an additional protective
D'accord,
layer
merci
for
beaucoup.
more vulnerable
Et
people.
par rapport à l'approvisionnement,
Follow-up question. With
à quel
regards
point est-ce
to
que ça
procurement and
influence
supply,
la façon dont, en ce moment, on prévoit distribuer justement
how will this influence the distribution of the treatment? Currently, there are many guidelines to be followed before we can get our hands on this treatment.
Un jour, éventuellement, quand on aura
So one
des
day,
millions et des millions
eventually, when we have
de ces
millions and
traitements-là,
millions of
est-ce qu'on peut
treatment
penser que les
courses,
règles vont être
can we expect
relaxées?
these guidelines to
C'est sûr que ça
be
va nous aider
lightened?
à traiter la
Answer.
COVID
Of course, this will
à plus
help
long
us
terme,
treat
à court terme aussi, mais à plus
COVID-19
long terme. C'est
in the
un
long term,
médicament
short term, of
qui
course, but
va
mostly
s'ajouter
long term.
probablement à
This is a
d'autres médicaments
medication
qui
that
sont
will
en
be
train
used
d'être
with other
développés présentement.
medications that are currently
Donc,
being
plus de
developed.
médicaments, c'est une bonne nouvelle.
So
Ça
more
permet de mieux
medication
traiter
is
et de
good
mieux
news. It
guérir
allows
les
us
gens.
to better
À
treat
nouveau,
and heal
j'insiste
people.
beaucoup sur
But again,
l'importance de focaliser
I
sur
would
le
like
moment
to
présent.
focus on the
Présentement,
present
avec
moment.
Omicron,
Currently,
avec la
with
crise
Omicron
actuelle,
and
c'est
the
la
current
vaccination
crisis, the
et les
best
mesures
way
de
to
santé
go
publique qui vont faire une
is to
différence
get
sur notre
vaccinated and to
capacité
respect
et la
public health
rapidité avec laquelle on
guidelines.
pourra sortir de cette crise.
This is the main thing that will get us out of this pandemic.
Thank you. Merci. The next question is from Alex Bellengal from the Toronto Star. Please go ahead. Your line is open.
Yes, good afternoon. Thanks very much. Just on the arrival testing regime that we have at the airport, we have Pearson Airport, WestJet, and Air Canada today coming out saying they want this this requirement dropped for, I believe it was asymptomatic arrivals, or remove mandatory arrival testing. So I guess for the mandatory testing for everybody. Wondering what you make of that, Minister Duclos, and if you think that's a good idea, if that's something the government is considering doing, given the limited testing capacity that we have, obviously, in this wave.
Well, thank you, Alex, for the question, and three brief elements as a response. First, we are in the middle of the Omicron crisis. I was looking at the numbers just a few hours ago. Globally, the number of active cases in the world has doubled just in the last 2 weeks. And the speed and the slope are very, very high. So there is a lot more Omicron infected people now in Canada as of January the 17th, as there were obviously a few weeks ago, but just a few weeks ago, certainly. And as I said, the trend is of great concern. There is obviously a lot of Omicron in Canada, and in Canada we have different levels of government. At the federal level, we have the responsibility to look after our borders, to secure our borders, and we take that very seriously. And we're using resources for testing, PCR testing at the border, which are different from the resources to which provinces and territories have access. So different responsibilities, different resources, and each of us at the federal or provincial level take our responsibilities seriously. The third thing I would say is that as the situation evolves, obviously we will keep adjusting our measures on all sorts of ways, in all sorts of ways, including at the borders.
Okay, so I guess different responsibilities, different resources. The arguments that I've heard is that obviously testing in general for PCR testing, the federal government could use the money and lab capacity that's going to these arrival tests to potentially help out provinces such as maybe Ontario and Quebec that are overburdened. I wonder what you think of that logic. I understand there's different jurisdictions, but maybe the capacity could be better used, I think some would argue. And then also, just to clarify the number of treatments quickly in the or the number of pills in each treatment of the new Pfizer treatment, if you could just clarify, is it 10, 20 in each treatment, I guess, package?
Thank you again. On capacity, I would also add that I'm in constant touch with my colleagues, health ministers across provinces and territories, and we are working together to make sure that not only do we have a good understanding of responsibilities, and they obviously have a role, at least a word to say on how we fare at the federal level in assuming our responsibilities, but also access to the appropriate resources that we need to deal with those responsibilities, and that will continue. On, I forget what your second question was then.
Oh, it's the number of treatments. I'm not sure if I'm on the line anymore, but number of treatments or number of treatments.
Sorry. Yes, so 30,000 treatments that come with 10 doses per treatment, 5 days, 2 doses per day. I understand from the technical briefing that you had this morning that it's the maximum number of days is indeed 5 days, and the treatments need to start no later than 5 days after the first symptoms have appeared.
Is there another question on the phone line? Okay, Minister, if there are no more questions on the phone line, I'll actually also ask you a question. Just on the vaccine mandate for truck drivers, could you clarify what the government is doing to monitor supply chains and whether it's leading to shortages and how the government will respond to that?
Thank you. I'll do that briefly. First, I think people are asking why we do that. Now, we do that because the best economic policy in the current context is a health policy that makes sure that everyone is protected from COVID-19, and the best protection is vaccination. We also No, this has been known for some time. Since November, all truckers and all trucking companies know that this is coming right now, and soon there will be perfect symmetry with the United States, because we both agree on both sides of the border that, again, protecting the health and safety of workers is also protecting the businesses that hire those workers and also protecting the supply chains. Now, as we have prepared for that, and as we keep monitoring the outcome of this important policy, my colleagues, Minister Algabra, Minister Tassi, obviously Minister Ng, others in the government, Minister Seamus, who is responsible, the labor minister, therefore with a direct and important relationship with federally regulated businesses, including the trucking industry. Now, we've been working very hard with them, and successfully with them, because the vast majority of truckers have not made the right choice. They have had a vaccine. So we are procuring the level of support and supporting the level of engagement that the industry needs and deserves. And we'll do this for as long as COVID-19 is there.
Okay, thank you. It's my understanding we still have the phone line, so I'll ask again if there are questions on the phone.
Yes, thank you. Merci. Sorry for the inconvenience. De nouveau, pour poser une question, faites étoile 1 sur votre appareil. Once again, please press star 1 on the device's keypad if you have a question. La prochaine question est de Boris Proulx, Le Devoir.
Next question is from Boris Proulx from Le Devoir.
À vous la parole.
You have the floor.
J'aimerais savoir, M. Duclos, comment vous vous sentez par rapport au fait qu'on caractérise les non-vaccinés comme des personnes vulnérables, donc qu'ils pourraient être privilégiés et avoir accès à ce médicament en premier?
Unvaccinated are criticized and how they will have access to this medication. Answer, yes, some of them are indeed vulnerable. They're vulnerable by the mere fact that they chose not to be vaccinated.
Si je peux ouvrir une parenthèse rapidement, on doit aussi être prudent lorsqu'on parle des non-vaccinés, parce que plusieurs types de personnes qui ne sont pas vaccinées, il y en a certains qui ne sont pas vaccinés parce que, bon, ils aimeraient l'être, mais ils ne trouvent pas le temps, d'autres qui voudraient être vaccinés, mais qui préfèrent attendre encore un petit peu pour avoir encore plus d'informations. Il y en a certains qui ont accès à des réseaux d'informations qui sont malheureusement trompeurs. Et il y en a certains qui sont vraiment contre toute forme de vaccination. Alors, quand on parle de non-vaccinés, on parle de beaucoup de gens. Et parmi ces non-vaccinés, il y en a plusieurs qui sont prêts et qui vont être prêts potentiellement assez rapidement à se faire vacciner. Maintenant, de quelle manière on traite les non-vaccinés? Bien, ça, c'est dans un contexte de bienveillance. Au Canada, on traite les gens comme ils sont, d'où ils viennent, peu importe leur passé, peu importe leur choix, on les accepte comme ils sont dans les services hospitaliers et pour d'autres services médicaux. Et quand ils arrivent à l'hôpital et qu'ils ont besoin d'une aide appropriée, adaptée à leur cas, bien, ils reçoivent cette aide.
Pensez-vous que les personnes qui sont sceptiques au vaccin vont adopter pour la suite le Paxlovid?
J'espère que tout le monde va comprendre que mieux vaut prévenir que guérir. Personne ne veut se retrouver avec un cas de COVID sévère, non seulement parce que ce n'est pas du tout agréable, mais parce que le Paxlovid ne garantit pas que la personne va être sauvée. Le Paxlovid augmente la probabilité qu'on va pouvoir réchapper cette personne, mais ça ne garantit pas du tout que la personne va connaître un épisode de santé modéré ou qu'il va s'en sortir à la fin de cet épisode. Donc, les gens doivent comprendre qu'il faut toujours mieux se prévenir que guérir, et d'abord à se faire guérir. Et c'est pour ça que la vaccination va toujours continuer à être l'outil de base, l'outil principal pour se protéger et protéger les autres.
Measure for protection of oneself and of others.
Thank you. Merci. The next question is from Ryan Tumulty. Please go ahead. Your line is open.
Yeah, Minister, I'm wondering right now the ability to get a PCR test or even a rapid test across Canada is pretty limited. I'm wondering if you are concerned that this new treatment will be difficult to actually, practically administer because it requires a positive test, especially since it has to happen within 5 days. Are you concerned that perhaps this drug will go unused because of that challenge?
That's a good question, and I believe experts answered a similar question this morning. And I'm not being an expert, I will provide a view which would not be as solid as the one you heard just this morning. First, on the people. Now, this is designed for people both that display characteristics that make them more susceptible to be vulnerable to COVID-19, and sometimes in circumstances in which it is more difficult for them to be treated. So people living in more remote communities with greater distancing from medical care provided in a hospital setting. So these types of people, immunocompromised individuals. So it's a population that is already suffering quite a lot from COVID-19. So that's good news for that vulnerable population. Now, this being said, there is obviously an important informational work that needs to be done, not only with clinicians, doctors, and nurses, for them to get to be fully aware of the uses and the possible benefits of this new drug, but also for possible patients, people that, as you alluded to, might feel symptoms of COVID-19, but that would not necessarily think of having a test, a rapid test or a molecular test. So sharing that information in provinces and territories with people that would already be vulnerable and sometimes more marginalized in terms of access to health information and health care. So sharing that information is going to be key in making that treatment as effective as possible.
Yeah, and just as a follow-up, you set Health Canada set priorities, or the Public Health Agency has set priorities for who should receive the drug. And relatively high on that list is people who are not vaccinated. I'm wondering if you're concerned that the pill could act as a disincentive to people who haven't been vaccinated, that they'll see the pill as something they can do instead of getting vaccinated.
I think not. I don't think so. I think this pill is going to be quickly understood to be used for people who would find it difficult to go through COVID-19 without the pill. But most of these people will have gained from being vaccinated. Now, you don't want to have to use that pill if you can instead be vaccinated. Vaccination is going to be a lot better at protecting you as a prevention measure. It's much better to be vaccinated and not to run the risk of having a severe case of COVID-19 than to have to be treated with Paxlovid because you're going to end up with a severe case of COVID-19. And I think most people will understand that, but it's obviously going to be important for every expert, doctors, public health officials in various provinces and territories to share that message so that, again, prevention is understood to be a lot better than just being treated or eventually cured for the disease.
Thank you. Merci. La prochaine question est de Mélanie Crête, La
The next
Presse.
question is from Mélanie Crête from La Presse. You have the floor.
Bonjour. J'aimerais savoir qu'est-ce qu'il y en est de l'approbation du médicament antiviral de Merck qui avait soumis sa demande bien avant celle de Pfizer.
Merck's antiviral medication, which was submitted for
Merci
approval way
pour la question.
before Pfizer.
Il faudrait voir avec les experts réglementaires de Santé Canada qui sont évidemment, tout le monde le comprend maintenant, des experts indépendants.
As you know,
Ce
they
sont
are independent experts.
de traitement, deux médicaments très différents l'un de l'autre. La soumission avec Merck, comme vous l'avez probablement déjà entendu des experts de Santé Canada, procède différemment et à une vitesse plus lente parce qu'il y a des enjeux plus spécifiques avec ce médicament.
there are
qui a
some
été soumis là, par Merck il y
specific
a déjà quelques temps.
issues for this medication that has been
Et
submitted
j'aimerais
for
savoir, en
approval
ce qui a trait à
some time
l'antiviral
ago.
de Pfizer,
Follow-up.
sur les 30 000
Regarding
boîtes là, en tout cas,
Pfizer.
que vous avez reçues,
On the
il y en a combien qui sont
30,000
destinés pour le Québec?
treatments that have been received, how many
Écoutez,
will
j'ai
be
à peu
sent to
près,
Quebec?
c'est autour de 6 000,
Answer.
si je me souviens
I
bien,
believe
pour
it's
le Québec.
approximately 6,000 courses
C'est per
that will be
capita,
sent
donc c'est
to
30 000
Quebec. So it's divided
fois la
per
part de la
capita,
population
so
du
it's
Québec. Donc c'est autour de
30,000
6 000
divided by the number
traitements là, qui ont
by
été
Quebec's
envoyés
population. So it's
ou qui
approximately
seront envoyés très rapidement
6,000
au Québec.
courses that will be
Et
sent
là-dessus, on me
shortly to
souligne
Quebec.
que, n'étant
And with
pas un
that,
médecin, évidemment,
as I'm not a
j'aurais dû ne
doctor,
pas spécifier combien
I shouldn't have
de doses
specified how
de
many
médicaments ça représente.
doses
Chaque
this
traitement
represents.
vient
Each
avec
treatment
3 doses par jour pour
has
5 jours.
3
So I'll say that in
doses,
English again because
3 pills per day
no,
for
people
5
ask
days.
why a non-doctor would speak about these things, but I was asked a question earlier. So it's about the treatment. One treatment comes with 3 doses per day for 5 days. J'espère que c'est une réponse suffisante.
I hope
Mylène.
that that's a sufficient answer.
Thank you. Merci. La prochaine question est de Pierre
The next
Saint-Arnaud,
question is
La Presse
from
canadienne. À vous la
Pierre
parole.
Saint-Arnaud from the Canadian Press. You have
Oui,
the
bonjour,
floor.
M. Duclos.
Thank you. Hello,
Ma
Mr.
première
Duclos.
question,
My
c'est
first question is
concernant le
this.
coût. À combien vous
It's about
évaluez
the
le
cost.
coût par traitement, et non
How
pas par
much-
dose, là, mais par traitement,
What is
qui
the cost
implique
per
là,
treatment, not
2
per
doses
dose?
par jour, en fait, sur 10 jours, là,
That
3
has
pilules par dose. Là, c'est
2
ce que
doses of
Santé
3
Canada nous
pills
dit
per
sur
day
son
for
site,
5
là,
days.
3 pilules pour une dose, 2 doses par jour,
So it's 3
5 jours de
pills
temps,
per
ça
dose,
nous fait quand
2
même
doses
là,
a day for 5 days.
beaucoup de doses.
So that's
Mais
actually a lot
pour
of
le
doses.
traitement complet, sur
But
5
for
jours,
complete treatment over
ça
5
représente
days,
combien?
how much are we
Bien, merci,
going to
Pierre.
be
La prochaine fois,
spending?
je vais vous demander de venir à la
Answer.
conférence de presse pour
You know what,
expliquer
next
tout
time
ça.
I'm going to
Donc,
ask you to
mais
come to
pour
the
le
press
coup, je vais
conference
me
to
tourner
explain the
vers
dosage.
Philomena, la ministre
But I
Tassi,
will
là, qui
I
va
will
pouvoir
turn this
mieux
over
vous répondre
to
que moi.
Philomena Tassi, the Minister of Public Services and Procurement. She'll have a better answer.
Well, thank you, Jean-Yves. You know, in order to protect the commercially sensitive pricing information, we can't disclose those details. What I would say is we have been very clear as a government that whatever it takes to help better protect the health and safety of Canadians, that's what we're going to do, which is why we have taken the step of procuring these doses and really are delighted that they are here now, ready to be delivered to provinces and territories. And I want to thank Pfizer for the strong relationship in working with us that we are in the position we are today, which is on the day of approval that we have the doses ready and look forward to those being used by Canadians to help protect them from the severe impacts of COVID-19.
En sous-question, M. Duclos,
As a
est-ce que c'est
follow-up
le
question,
plan d'avoir
Mr. Duclos.
suffisamment de l'antiviral de Pfizer
Have you planned
pour
to
en
have
faire une
enough
distribution
of
à
Pfizer's
n'importe qui, là, sans
antivirals
prioriser?
to be able
C'est-à-dire qu'une
to
personne
give them to
qui,
anyone
par exemple,
without
développe
having a
des
priority
symptômes
list? So anyone
et
who develops
pourrait être à
symptoms
risque, mais sans nécessairement là, avoir les
that could
conditions,
or could not
les
be
conditions
susceptible
concomitantes
to grave
dont
illness,
on nous
who
a fait
doesn't
part. Est-ce que
satisfy the
c'est dans les plans
criteria.
d'avoir une distribution possible pour
Are we
l'ensemble de la
hoping to
population,
have enough
nonobstant
to
leur situation?
distribute to the entire population?
Deux choses. La première,
Answer,
c'est que
two things.
ma compréhension de ce que
From what I've understood,
les experts réglementaires du gouvernement canadien
governmental regulatory
ont dit, c'est
experts have
que
said
la soumission
that
qu'elle a été fournie par Pfizer, c'est une soumission bien particulière
the submission
dont les tests
from
essais cliniques
Pfizer
ont été faits sur
was
des
very
populations
particular. It
particulières.
was
Et ce sont
the
pour ces
trials
populations particulières qu'on
performed
connaît
against a specific
les
group of
impacts là,
people.
sur la réduction
So,
de la probabilité d'avoir des symptômes sévères
our
de la
understanding
COVID-19. Donc,
of the
pour ce médicament
medication's
dont on parle
impact
aujourd'hui,
in
le
reducing
Paxlovid,
odds of
c'est pour ces
grave
populations
illness
vulnérables
is for these vulnerable
dont on parle.
populations.
Alors, bon, deuxième chose, c'est qu'il
The
pourrait y
second
avoir
thing is
une couverture plus large
that we could
pour ce
have
médicament.
broader
Ça demanderait
coverage
fort
with this
probablement
medication.
la fourniture par Pfizer d'informations
But
cliniques
Pfizer would have to
additionnelles
provide
à Santé Canada,
additional
où il pourrait y
clinical
avoir
information.
d'autres médicaments fournis par Pfizer
Alternatively,
ou
there
par
could be
d'autres
other
entreprises
drugs
pharmaceutiques dans
produced
le
by
futur,
Pfizer or
dont la
other pharmaceutical
couverture clinique pourrait être
companies
élargie par rapport à
that
Paxlovid.
have clinical data to complement drugs like Paxlovid.
Thank you. Merci. La prochaine question est de Éric Plouffe, Radio-Canada.
The next question is from Élie Plouffe from Radio-Canada.
Bonjour, Monsieur le ministre. Pourriez-vous nous préciser votre position à propos de cette demande d'assouplissement des mesures à la frontière et cet appel de médecins hygiénistes, de compagnies aériennes notamment, d'abolir l'obligation de faire passer un deuxième test PCR aux voyageurs aériens qui arrivent au Canada?
Merci pour la question. Trois choses ici. La première, c'est que la situation épidémiologique au Canada et ailleurs dans le monde se détériore. J'observais qu'il y avait à peu près 31 millions de cas actifs de COVID-19. Au 1er janvier, on est rendu à plus de 50 millions maintenant dans le monde. Donc la pente d'accroissement des cas de COVID est très forte ici au pays, mais aussi ailleurs dans le monde. La deuxième chose que j'ajouterais, c'est que nous avons des responsabilités au gouvernement canadien en matière de gestion de la frontière, qui est une des sources, évidemment, de transmission de la COVID-19 lorsque les gens se déplacent, lorsque les gens voyagent, inévitablement, ils sont en contact avec d'autres, ils peuvent attraper eux-mêmes la COVID-19, mais ils peuvent aussi transmettre la COVID-19 à d'autres avec lesquels ils sont en contact durant leur voyage. Et pour assumer ces responsabilités, le gouvernement canadien utilise des ressources qui sont distinctes des ressources auxquelles les provinces et les territoires ont accès pour leurs propres opérations de test. Nous avons nos propres fournisseurs et des endroits différents, évidemment, autour des frontières auxquels les fournisseurs sont actifs. Et la dernière chose, c'est qu'on a toujours fait, et comme les gens s'attendent à ce qu'on le fasse toujours, on va continuer d'ajuster nos mesures en fonction de l'évolution de la situation.
Donc, c'est pas une possibilité pour le moment.
Présentement, ce n'est pas ce qui va se passer, parce que présentement, on est vraiment probablement au Canada, même pas encore au pic des infections. On l'espère tous que ça va arriver rapidement, mais on n'a pas encore d'évidence claire que c'est le cas. Et quand on regarde en dehors du pays, on s'aperçoit que cette situation dans beaucoup de pays est de plus en plus grave.
Is worsening.
Thank you.
This will be the last question over the phone.
Very well. Thank you. Merci again. The next question and the last will be Palak Mangat from Parliament Today. Please go ahead. Your line is open.
Hi, thanks. This question is for Minister Tassi. It's on the costing front. I did hear my colleague ask about the possibility of this treatment being quite an expensive one to secure, but you didn't really provide a clear answer other than to say that we can secure another, I think it was about 500,000. Can you clarify if that's on the same contract or if you expect to take advantage of that given some of the practical challenges that we know about securing test results and the like, or will it essentially depend on the uptake of the existing supply flowing in?
Yes. So we're delighted to have secured this contract, which is, for the 1 million doses. We have an option for 500,000 more. I think the timing of this is also very important, which gets to your question, which is at a time where hospitals are filled and they're having trouble accommodating all the patients, that this antiviral, that the bottom line is that the effect is that it keeps people potentially out of the hospitals is so very important. So we're going to monitor that, but this contract is for 1 million doses, but we have the option to exercise a purchase of 500,000 more.
Okay, thank you. And also to Minister Tassi, I know the government's sort of previous positioning on vaccine contracts, and I'm wondering if there has been any word yet to your office or the department around the Auditor General and when she could begin her audit into the contracts that we've got signed so far. And the reason I ask is that really seems to be the only source of transparency around vaccine-associated costs.
Yeah. So I would say this, listen, let me be clear. From the very beginning, we knew that we had to act and procure in order to protect Canadians, and that's what we've done. There are, of course, times where the information is commercially sensitive and we can't jeopardize the contract by disclosing that information, so we adhere to that. We are working tirelessly, of course, to get our hands on every possible measure that we know is critical to combat this fight against COVID-19. And so the assurance that I can give you is that every step of the way, we are always acting in the best interests of Canadians, looking ahead, procuring what's necessary, and doing that in a very responsible way. And ensuring that the health and safety of Canadians is first and foremost, and respecting that there are times where we can't disclose the amounts, and and we're not going to put Canadians' health at risk by violating those provisions and putting the supply at risk.
Okay, we are going to turn quickly back to the room for one or two more questions since there were so many more on the phone, starting with Tom Perry with CBC.
Hi, Minister Duclos. You were asked this in French. I was just hoping to get you in English. Why are unvaccinated Canadians among the group of people considered to be at a high priority to receive this treatment?
Thank you. We heard the answer this morning by experts. What was also said, and what I'm pleased to repeat, is that in Canada, we treat people as they are. And according to what healthcare needs they may have. So that's what doctors and nurses do every day. They don't ask questions about people's choices or people's human nature. They look after people. They care for people. This being said, a drug is a treatment. No, it's much better not to have to be treated. And the best way not to have to be treated is to be vaccinated. So you don't want to end up with COVID-19, even though you might be given a drug. No, that's not what you want. You don't want to have COVID-19. And the best way not to have COVID-19 and not to run the risk of being severely ill is to be vaccinated.
And we will go to CP for the final last question.
For Minister Duclos, Jim Brodsky with CP. Just to follow up on the earlier thread about China and Tom's questions on that topic. You mentioned you have an opinion about whether a piece of Canadian mail could introduce Omicron to Beijing. What is your personal opinion on that assertion from the Chinese authorities?
Well, the opinion that matters most has to be based on information and on expertise. So that's why we will all want to defer to the views of experts on that, and I will ask my own experts within the Public Health Agency of Canada to look at that.
So you're not ruling out the possibility that a piece of Canadian mail introduced the Omicron variant to China?
Well, I find this to be an extraordinary view, but again, I am not an expert, a doctor or a virologist, and I will ask the right people to provide and to produce the right advice and the right views.
Comment qualifier cette allégation?
C'est une allégation extraordinaire, mais je ne suis pas un expert. Donc, j'ai demandé à des experts virologues à la santé publique du Canada de se prononcer.
Okay, that ends our press conference. Thank you to the ministers for being so generous with their time. That's the last press conference for today.
Thank you.
And then 2 on